Good morning. Welcome to this pre-recorded version of For Your Health, a presentation of Medica Pharmacy with locations both here in Bardstown and in Shepherdsville. And with us this morning, Alyson Schwartz. Good morning, Alyson.
Good morning.
Well, we continue on before we get into some heavy-duty subject matters. This is Diabetes Awareness Month, and that is heavy-duty because it is such a devastating disease that affects many people, young and old alike.
It does. I mean, and it's just growing and growing. And, it's just estimated that, in the next 20, 30 years that the vast majority of the population is going to have diabetes, or what they say is pre-diabetes. But in most of our minds that our healthcare providers, pre-diabetes is diabetes. Once you are pre-diabetic, you're at every bit of risk of all the complications as being a full-blown diabetic. You're already at the heart attack risk. You're already having complications to your nerves and to your kidneys. And so you can already start to affect your vision. And it's really something we need to be aware of. And it all starts with what we're eating. I mean, really, you've got to exercise, but we've put so many chemicals in the foods that we eat, and we don't eat healthy in this country, and it really starts with what we're eating.
So wellness and doing healthy things is one thing, and then for those, though, that tragically already suffer from diabetes, there are things to help them, and that's where medical pharmacy does come in with everything from the shoes that I know we've been talking about this month already to other nutritional products. Oh,
absolutely. The shoes are a big thing for a lot of diabetics when they have problems with their feet and they're uncomfortable, they don't have feeling. I mean, I've heard horror stories, I've seen some horror stories about diabetics that get things stuck in their feet because they've lost feeling and they're not checking their feet. And they get, next thing you know, they have a bad infection and they either lose a toe or maybe they lose the whole foot. And we actually did have someone come into our pharmacy yesterday for the diabetes day that we had, and that person was on a wide array of medicines, had been diabetic for a while, had never been in our pharmacy, and no one had ever told that patient they needed to check their feet. And as a diabetic, that's one of the most important things that you should do is, shower and sit down and check your feet every day. And so I was just amazed that, as well known as that fact is we still have a patient that's been diagnosed for a long time and had never been told to look at their feet. So please be looking at your feet. But if you're having trouble with your feet or you want to get some information on the diabetic shoes, I mean, a lot of insurances do cover them. You do have to qualify. You have to have certain things going on for your insurance to maybe pay for those shoes. But if you're unsure, stop in. I mean, we'll do the legwork for you. We'll contact the insurance company, get the diagnoses from your doctor. It is the end of the year, so the vast majority of people have met their deductibles. I know with that's especially important when it comes to Medicare patients. So stop by and let us, do a shoe fitting, get some information, and see if you qualify for a pair of diabetic shoes through your insurance.
Okay. Today we want to talk about, there was a article, a white paper or whatever that came out, talked about the overuse of antibiotics.
Yes, antibiotics, yes.
And we as a state were way up there? Or?
Horrible. We're horrible. And it's one of those things that I know as pharmacists, all of my pharmacist friends, my students, colleagues at work, we always talk about how everybody that comes in seems to be on an antibiotic for the silliest thing that you're thinking, why do you really need that? And we've known for many years that the resistance to antibiotics is growing. I think it was 5 or 6 years ago, there was actually a continuing education seminar in Lexington where the infectious disease physician and pharmacist at the University of Kentucky actually had data that showed that Nelson County, our very own county, had the worst antibiotic resistance, the highest resistance of any county in the state of Kentucky. And it just shows that we're just massively overusing antibiotics when we don't need to be. And so now the CDC comes out with a report that says, Kentucky, you've got to stop using antibiotics. We're getting to where we're running out of drugs to treat infections. And my favorite, we were just talking about this at the pharmacy when we were reading that report. I said my favorite thing is when somebody's diagnosed with the flu and they come in to get Tamiflu, which they may not even need that because, again, we're getting resistance to the antivirals as well. But then they're also given an antibiotic. And so oftentimes you'll call and say, well, if they have the flu, why are we giving an antibiotic? The flu is not bacterial. Antibiotics do not treat the flu. And oftentimes we're told, well, it's just in case to prevent that secondary infection. You do often get a secondary infection from the flu. Pneumonia is the most common thing. But don't treat it unless you get it. Don't give an antibiotic unless you get it. Don't necessarily treat the flu unless you're really going to be a really bad case. If you're a young, healthy adult and you get the flu, then I hate to say this, but for the goodness of the future generations and maybe your children, go home and go to bed. Don't be filling these medicines that you may not need. Just because you have a runny, stuffy nose doesn't mean you have an antibiotic necessary to treat whatever that sinus infection you think you have. And I know a couple of weeks ago I talked about antibiotics and the risks with some of them. So they have their risks of heart attacks and tendon damages and everything under the sun. And, of course, a lot of women understand, unfortunately, that when you take an antibiotic, you kill off your good bacteria. So a lot of women out there end up with yeast infections, and then they're taking an antifungal to treat that. So really, really talk to your doctor. Do you really need an antibiotic? When we give antibiotics out like candy to children with ear infections, and there's lots of studies out there that say ear infections don't need antibiotics. They're mostly a viral based and they don't really do you any good. So we have to really, we're in a society of we want a treatment and we want a pill and we want something to make us feel better right now. But is that really the right thing for us to be doing? I mean, if what happens if we create enough resistance that all of a sudden we just can't treat anything anymore? And where are we going to be? So it's just it's really something to think about. And it's, I know we go into doctors and they're busy and we're busy and everybody wants to get in and get out, but really make sure you need that antibiotic. And, I'm a big fan of saying, wait for a couple days. I mean, the biggest joke in pharmacy school was if you have a really bad cold and you're congested and you can't breathe, that if you go to the doctor and get an antibiotic, you're going to feel better in about 10 days. And if you don't go to the doctor and you stay home, you're going to feel better in about 10 days. Now, of course, I know I've been promoting the use of some of the immune stimulant stuff, and we have stuff called Viraclear and Thymuril, and I am a big promoter of that because I know for me and a lot of other people I've recommended it to, in about 24 hours, in a worst case scenario, 48 hours, so 2 days, you feel better. So you don't have to take an antibiotic. You get that kind of sneezy, sniffly, something's coming on. If you start taking those supplements immediately, it greatly reduces the severity. It really has no side effects. I mean, the Thymuril's a big pill, so if you can't swallow a pill, it's a little bit problematic, although you can break it up. But, support your body through those type of things instead of, do you really need that antibiotic? When, the vast majority of the time, those cough and colds and sniffles are not bacterial. They're viral. And so taking that antibiotic makes you think you're doing something when really you're not helping it. You're probably making it worse in the long run.
So you have talked before about the fact that there are some natural products that you have at Medica Pharmacy that what we can do in lieu of antibiotics.
Exactly. And all of the stuff that to try to treat, that is really time sensitive. So you don't want to wait until, you feel that cold coming on and you kind of say, oh, well, maybe it'll be okay. And maybe I might take a little bit of vitamin C, or I'll make sure I'm drinking my water, or even worse, you're going to drink your orange juice to get your vitamin C. And that's loaded with sugar. And any type of virus or bacteria loves sugar. So in essence, you're really feeding it with those juices that you're giving yourself. So if you wait 4 or 5 days to where you really can't breathe and you're really miserable, they are not as effective. So I'm like, if you can start that, and most of us know that day you're going to get a cold, your head feels kind of odd. You might have that kind of sneezing a lot, your nose kind of itches, maybe your throat's just ever so slightly sore, but you're like, I just don't feel quite right. Well, start taking those supplements immediately. I mean, I tell people all the time when they ask about them, do they work? And I'll tell you, I don't ever not have a bottle of them in my house because you never know when you're going to wake up on a Sunday morning and you just don't feel right. Mm-hmm. And so you start taking them immediately, and knock on wood, typically I feel better by the next day. And I have a lot of people that say the same things, like I can't believe how much better I felt and how fast I felt better. So it's definitely worth a shot. I mean, the Viraclear is safe for 2-year-olds and up. So it's, a great tasting, most liquids don't taste very good. I mean, they have that medicine-y, yucky kind of taste. This one doesn't. I mean, it really is a nice tasting liquid. So I recommend that a lot to just keep on hand this time of year. It's the time of year where we're all going to be coughing and hacking and sneezing and trying to pass things around. So keep those stimulants in there so that we hopefully don't continue this trend of craziness over using antibiotics.
And you mentioned one of those product lines.
Viraclear or Thymuril?
Yeah.
The Viraclear. Mm-hmm.
Yeah. So what are some of the others that are out there, or is that?
Viraclear is the liquid, and it's actually been studied in mono. There's a pediatrician in Louisville that uses it exclusively in her kids that have mononucleosis, and she has them back in school in less than 5 days, they're saying, which is unheard of when it comes to mono. Usually mono, you're out for a couple of weeks at least. So ViraClear is the one. So any kind of upper respiratory infection, it's really good for. It's great for mono. It's great for the cold. So bronchitis, it helps with that. The other one is Thimeril. That one has some vitamin C and selenium. It's got some echinacea. It has some thymus gland extracts. Then there's also little things. There's something called Esbiritox, which is a chewable kind of high-powered echinacea supplement, so it's good for kids as well. Adults can take it, but it's also one of those 2 years of age and up. And in all honesty, you can give them to an 18-month-old, but you don't really want to give it to any child that's much less than that because their immune system is still forming. And so you don't necessarily want to give something that's going to boost their immune system when it's not quite fully formed yet. With the same, but then you can bounce that back on. That's why I'm not a big fan of antibiotics, is when you immediately take an antibiotic, you kind of inhibit your body's immune system from working the way it should, and so then you're more prone to getting sick down the road. Vitamin C is always good for sickness, and not because it really makes you feel a ton better or shortens it. But when you're sick, you're under stress. And I talked about the adrenal glands a couple of shows ago and how when you're under stress, your body just burns up vitamin C. So the reason for vitamin C is not that it cures the cold, but that it supports your body in that stressful situation. And so anywhere from 2 to 5 grams, so 2,000 to 5,000 milligrams of vitamin C while you're sick. And then zinc has been shown to lessen the severity of cold. So, but the Thimeril has all that in there. And that's why I typically go with that product. I will say if people are out there looking at stuff like Airborne, if that works for you, that's fine. But I have a lot of people that ask about Zicam. Now, the Zicam tablets, that's fine. Do not use the Zicam nasal spray. And I don't even know if it's still available. We pulled it off our shelves and sent it back and never carried it again years ago when we found out that using nasal zinc can destroy your ability to smell permanently. So we sent it back. And I actually know a couple of people that have loss of smell from using the Zicam nasal spray. So stay away from the nasal sprays. And but there's, ester Cs and there's all these other little products, and none of them will hurt you orally per se, but you have to be, again, selective with your products to make sure that it is a product that's tested and studied and shown to be beneficial for you.
A vaccine like a flu vaccine or a pneumonia vaccine is not an antibiotic. So.
It is not. Yeah, so we definitely still want to say, get that flu vaccine, because even if they guess wrong, and, I have a lot of people say, well, I got the flu vaccine, but then I ended up with the flu. Well, you might have, but I'd be willing to bet you that if you hadn't had that vaccine, you'd have gotten a worse case of it. Yeah. So you may get the flu, and it's not, vaccines aren't 100%. They're, a lot of them are not 100%. But they do lessen the severity of the disease if you do get it. So flu shots, pneumonia shots, whooping cough is still a big thing, and we have a lot of doctors pushing to go get that whooping cough.
Shingles too now?
And the shingles, yeah. We have been doing, shingles and whooping cough and flu and pneumonia. We've done it, flu every day. We're actually running out of flu vaccine. So if you haven't gotten your flu shot, you might want to come in and get it because we don't have a whole lot of flu vaccine left. Pneumonia vaccine we can get anytime. The Tdap for the whooping cough, we have that in. And then the shingles. We do some vaccines every day. And but the Tdap, the whooping cough, is the big one that all of a sudden people are starting to come in and ask about it. We have it. We have a protocol for it. So, talk with your doctor, find out if they feel you need to get it. If you have small kids in your family, or you have a daughter-in-law or a daughter or, granddaughter even that's pregnant, going to have a baby, that's something you need to think about.
Compounding. Tell us a little bit about why it's in the news.
So a lot of people might have seen recently that there was this huge meningitis outbreak, and it was all linked to a compounded form of a steroid that was being injected into people's backs and joints and whatever. And so it creates this huge scare. And, every time I joke that whenever the big drug companies have a drug that is not safe, that it's kind of like, oh, well, golly gee, beef, that's just too bad. But the minute that somebody compounds a medicine and something goes wrong, it's, oh, my gosh, compounding's not safe and it's terrible and you should never use it. So I want to kind of bring that up, that when you're compounding a sterile product, you're compounding something that's going to be injected into the vein, into the joint, whatever. There are a lot of risks with that. There are a lot of risks with every medication you take. So you have to follow strict guidelines. we do compound at Medica Pharmacy. We do not sterile compound, and that was really one of the reasons. Is you have to be so strict and so careful, and it's so hard to do it with no risk. And you can do a lot of great things with compounding, whether you take a pill and make it into a cream or a suppository or a gummy bear or a lollipop or whatever dosage form that you want, without preservatives, without dyes, without food colors. So it's good for a person that can't swallow, an autistic child, a dog, a cat, whatever it is that you can, really make giving that medicine easier. Compounding is wonderful. You can do great things with it. So, yes, there are risks to it, but I want to point out to people that it's not that compounding is unsafe and that people shouldn't compound. Because if you really look at the cases of problems that have gone awry with people compounding, and it's almost always a sterile product that has the problems when it comes to compounding, I want you to just go out there and look. You can go online and look at the number of drugs that have been proven safe and effective by the Food and Drug Administration that kill people and get pulled off the market because they're devastating. They find, they're safe, but they're not safe. So it's not that compounding is not safe. Anytime you're messing with medications and injecting anything into your body, there are risks. And so just because there is a pharmacy that is compounding something specially for you, that doesn't mean it's not safe. When you look at the number of drugs, the Vioxxes, the fenfluramines, there is just a huge list of medicines that were deemed safe and effective by the Food and Drug Administration that were found out years later that were horrible safe. So you have one incident, off and on, that you have an incident of compounding that something happened. They didn't, something in their sterile process didn't go well, and so they had a fungal problem with that product because they didn't, somewhere it got contaminated. And so people got meningitis and some people died. And that is horrible, and I would never say it's not. But it doesn't mean that compounding should not be allowed. And so I just want you to realize that, yes, there were incidences and there were bad ones, but there's also horrible problems that come up from your everyday medications that are studied and tested and made in strict guidelines, and the FDA says they're safe. And those medicines are not always made here. And so, GlaxoSmithKline, they're making these safe drugs up in New Jersey. Well, you don't know if they're making them in New Jersey, if they're making them in China. And so everything has a risk. And I just wanted to say that, if you have questions or concerns about compounding, please call us. We don't do the sterile compounds. So pretty much, everything we do, it's really not risky. I mean, yes, anytime you take an oral medicine, it could. So maybe you come in and your doctor wants you on some oral formulation and it's not the right medicine for you. You might have an adverse reaction. But as a whole, compounding is a great alternative. And if you do it right, it is no less safe than the average commercially available product that's out there. And a lot of times they're safer because they don't have the additives and preservatives in them.
Anything else going on at Medica Pharmacy? We're in the holiday season.
We are in the holiday season, and so it's, again, I always talk about it's supposed to be the most wonderful time of the year, and somehow we make it the most stressful time of the year. And it's enjoy the season. I mean, it's like I went to the Leadership Nelson County graduation dinner last night. I was very honored to be their guest speaker last night. And I walked into Maywood and I'm like, oh my goodness, it's decorated for Christmas. It's only November 14th or whatever. And I'm thinking this is insane. And so you immediately I could feel my stress going up going, well, I don't have my Christmas decorations out. I haven't even thought about shopping, So, and it's like, wait a minute, there's no sense in getting upset about it. Christmas is going to get here, and if you, maybe you don't celebrate Christmas, and that's okay, but if you do celebrate it, enjoy it. Try not to let yourself get overwhelmed. And, I talk all the time. We do have great stress supplements, so we have some cortisol manager and some Lavella that if you get stressed out will really help you just relax and enjoy the day. But, please manage your stress. Take a few minutes to even if you just stop and close your eyes and take a couple deep breaths. Christmas is going to get here, whether we are ready for it or not. And you know what? I'm sure it always works out in the end. It's kind of like those brides that freak out about their wedding. Oh my gosh, you might forget something at your wedding and nobody else is going to know and it's going to go just fine. Yep. Christmas is the same way. And so, you got Thanksgiving and Christmas and New Year's and just boom, boom, boom. Enjoy it. Try not to stress about it. So, if you really are one of those high stress people and need help, come talk to us and we'll be glad to try to help get you through that. But other than that, it's just, it's coming around cough and cold. So we're starting to see a lot more coughing and hacking and sneezing people. So we're trying to get you healthy.
Cover your mouth, wash your hands.
Wash your hands, that's right. And cover it, when you cover your mouth, don't cover it with your hands. Cover it with your elbow or the inside of your jacket. I mean, I always get laughed at because I would always pull out my lab coat and cough or sneeze into the inside of my lab coat, and somebody said, "Well, that's what's in there." I said, "Well, it's better than having it on my hands." So and if you do cough or sneeze into your hands, please immediately go wash them.
And wash them with good soap and water.
Soap and water, no hand sanitizer, please.
Okay. Right. Alyson, thank you very much for taking time out of your busy schedule and enjoy the day. And as you've said, a stress-free life is a healthier life for everybody.
It is. We get one life. Enjoy it.
Yeah. Alyson Schwartz, Medica Pharmacy. You can find them online and on Facebook and Twitter and all those good things, right?
We're everywhere, so please find us. And, of course, we have the YouTube channel, so anytime you miss a radio show, if you'll, check with us or find our YouTube channel or go to Facebook, you can find those recordings of the past radio shows.
You got it. Thank you very much. That's our show today, For Your Health, a presentation of Medica Pharmacy.